All right, Qualcast Nation, I have a dear friend, in some ways a colleague, neighbor, all things, I don't even know what to say. Dr. Jesse Pierce in the house. Welcome to the show, Jesse.
Thank you so much, Claudia. It's great to be here.
I am so excited about the topic we're tackling, peptides, because this has been a bit of a mystery to many of us. Like, we group a lot of them together, and we've seen a lot of talk about Ozempic and so forth. But maybe we could start off with, at a high level, what are peptides, and why are we so excited about covering this topic?
Yeah, this is great. So, peptides are basically branched amino acids that make up proteins, and they're actually needed in our body to stimulate certain receptors. So, for example, insulin is a peptide, and we need it. It's a 51 chain peptide, and we need that insulin to get sugar into the cell so that we can utilize it. So, all of our hormones are also peptides. And so they are needed in our body, and they stimulate receptors to help our body function better.
Absolutely. So
Mhm.
when we think of peptides these days, we get a lot of talk about the GLP-1s
Yeah.
and Ozempic, and so you have a bit of a different take. So maybe giving us a sense about, like, what I mean, the peptides that we often are hearing about and what the concerns might be.
Yeah. Yeah. So the Ozempic is a GLP-1 agonist, and the way that that's traditionally used, Ozempic or Mounjaro, is in really high doses. So the starting dose is quite high. People tend to get really intense side effects like nausea and appetite suppression. And the issue is, they are really helpful for weight loss, but we want weight loss to be very slow and steady. So they're very effective at causing people to lose weight. But when people lose weight way too fast, they're going to lose bone, they're going to lose muscle. They're probably not going to be focused on eating the most nutritious foods because they have a low appetite. And so we're seeing side effects and issues with these drugs because I personally think they're not dosed properly. They're not dosed alongside a lifestyle promotion to help people really make the changes that they have to make. So there is a lot of controversy on using these peptides, but I am a huge fan, and I think they're really effective. There's so many incredible studies coming out that they do decrease cardiac mortality in people who are obese. They help get people's inflammation back into range, which is exciting because we all know that those inflamed patients end up in the ICU with you after a long time of being sick.
Absolutely. So
Yeah.
this is where I'm getting excited, because I've always grouped it as, the GLP-1s used in diabetics, used for weight support, like to reduce
Yeah.
your weight, and so, as you talked about, the concerns have been with with the with the loss of lean muscle mass and
Yeah.
some of the other side effects. But there's this whole other world that I was not aware about. And
Mhm.
I started to look a little bit into it when it came to, like, what was it, BPC 157,
Yeah.
called my eye
Yeah.
for repair of soft tissue.
Yeah.
But then I heard, I think it was JJ at Eudaimonia talking about some of the benefits at a lower dose
Yeah.
of these peptides for the
Yeah.
inflammatory,
Yeah.
exactly what you're saying.
Yeah.
And so, maybe to put it into context, what, like, how are you using them as a clinician?
Yeah.
In what setting?
Yeah. So I can give you an example. Actually, I can give you a personal example. So for me, I've learned about peptides for a long time. Same with you, the BCP 157, KPV. There's these peptides that actually can heal the gut, heal the joints, and those are really effective. But I started to recognize that, wow, there's these, if you're microdosing and taking little baby doses of GLP-1s, and specifically GLP-1 GIP, which is tirzepatide, and such a small amount that it can make a huge difference in helping people achieve their health goals of potentially losing, that 5, 10, 15 pounds that people are holding on to. But not only that, helping with the neuroinflammation. So I actually heard JJ speak this fall in September, and she ran an amazing tiny little workshop on peptides. And she talked about using them with her son, who was in a tragic car accident and basically was left with a huge TBI, a big traumatic brain injury. And they had tried a lot of different medications and mental health medications to stabilize moods. And JJ said this, I think she even said it on your podcast, that that these peptides are as happy peptides. Like, they really help drive down neuroinflammation, and as a result, increase serotonin and increase mood stabilizing hormone transmitters. And so that was a big game changer for me, as far as thinking about how can I use these in practice. And I got very excited about that, because we do have I personally see a lot of people with brain inflammation, and we can work really hard to clear it by changing up the diet and really reducing inflammation from a diet lifestyle perspective and stress reduction, but never this quickly. So I came home and got a prescription for tirzepatide. And because I've been weight training intensely over the last 18 months, I just saw a very quick transformation for me, because my GLP receptors going into menopause have been not working quite optimally. So I think my receptors needed just a little stimulus. And so I had a pretty dramatic improvement in my lean muscle mass and loss of fat loss, which was very exciting. But actually, what I was more excited about was the neuroinflammation, the low grade brain inflammation, the feeling scattered with finishing my charts at work, and taking longer to do my charts than I used to a few years ago. And that's been incredible. Like, I didn't know I had neuroinflammation. I thought, oh, maybe screens are like leading to a bit of ADHD symptoms for me, because I'm on screens way too much. But in the end, these peptides have reduced, because we have these receptors in our brain. So by stimulating the receptors and driving down neuroinflammation, I've seen a huge improvement. And it's interesting, because I've run CRP, my CRP is at 0.14, like, it's so low. And my ESR is low, so I don't have any inflammatory markers. I don't have elevated cholesterol. So nothing that's pointing at neuroinflammation, and even my HbA1c is 5.2. So nothing that would be pointing at inflammation in my system, and yet my neuroinflammation, likely from menopause, has improved so much. So that's my own long-winded story. And then from there, it just got into, wow, we have to use this with patients. And so I teamed up with a nurse practitioner, and we put an incredible program together to teach people the lifestyle changes they absolutely must make if they want to use these peptides. And then from there, the success stories have been incredible.
Amazing, Jesse. Like, we'll get into the success stories for sure, but just maybe for my education here too. So we're saying that GLP-1s, because I'm learning
Yeah.
here as well, they can affect neural inflammation.
Yeah.
They can affect, like, how do they affect, I guess, lean muscle mass? Like, in your case, when
Yeah.
you found that you started to take low dose, um, why
Yeah.
did that make things better?
Yeah, I think genetically, I think it's a couple things. I think toxins and like potentially pesticides have affected those receptors. And in some people, they're just prone to be a little heavier set. My fasting insulin is quite low. I think it's at 30 in the morning. And we'll talk about fasting insulin because we see a crazy link between BMI, very heavy obesity, and skyrocketing fasting insulin levels of like 190 and 236. So as soon as these people put food in their mouth, their body says, store my fat, right? And they're never going to lose weight with a fasting insulin of 230. So for me, when I sort of got started, like I think I just genetically, my dad's side of the family, everyone's a little heavier set. So I think I have the genes that those receptors just needed a little extra stimulus. And I ate a lot of protein. I did all the things right. I worked with a trainer and I ate perfectly and I was able to lose a bit of weight with my trainer and it was great. But then, I quickly gained that back as soon as I made any changes to my diet. I added a few little things back in that I had been restricting and I gained that weight back. And that was always I'm always up a few, down a few, up a few, down a few. But the terzepatide for me stimulated those receptors that just said, oh, wait a minute, you're storing too much fat. Like you're storing too much fat in your abdomen, in the places we actually don't want you to be storing fat. So for me, because I was already optimal with my exercise, my eating, the body just quickly stimulated those receptors and said, and I was able to lose that pound a week until I hit my optimal level. And I get the BIAs. I'm stronger in the gym, but I was doing BIAs and I
What's
had zero
BIA?
bone loss. Oh yeah, at the gym at Alte, they have this thing that you put your hands on and they can measure fat, bone,
Oh,
muscle,
oh yes.
and water. And I had done my BIA before and after, and I just had a major increase in lean muscle mass, loss in fat, and zero bone loss. So, and now with my bones, I'm even working on tons of jumping and like really trying to stress out my skeletal system to just prevent bone loss. So
Brilliant.
I have no worries about, I don't think these peptides in microdose are ever going to affect and touch the bones. Even of people who potentially have osteoporosis. Like I think in microdose levels, when you're building muscle and you're doing things to try to maintain bone loss, you're not going to get the bone loss.
So this is really exciting. So basically, almost somehow, and like in your case, upregulating or opening up those GLP-1 receptors, which allowed you to
Yeah.
be more uh, like using the fat as fuel and use and mobilize that fat. You're leaner.
Mhm.
You're
Yeah.
what do you count the increased lean muscle mass from? Is that is that
Yeah, so yeah, it's at the BIA scale that they have at the gym that I work out. Like it's
oh
pretty.
sorry, I mean like do you think that's directly related to the GLP-1 or do you
I
think
think
that's
it's yeah, probably as I've leaned out, I'm also still strength training, right? I'm
yeah,
still building muscle. I've always been, I mean, that's one of my goals is to just look a bit like you, just be as strong as I can be. And so for me, like that, I've always been strong. I've always been the girl that can beat anyone in an arm wrestle.
very
But that's my goal to like strength train and be as strong as I can. But I'm getting stronger, and I'm so much closer to the chin ups and the pull ups because I don't have the fat weighing me down as much. But also temperature wise, I'm feeling less cold this winter than I probably had other times. So I know my metabolism is revved up. And, I think the terzepatides in microdose and the peptides, they do that a bit. They do increase your metabolism. But
very
it's all about the Goldilocks dose, right? Like I always say it's one size fits all. So when you get a type 1 diabetic, not everybody takes the same amount of insulin. It depends on how insulin insensitive they are, how inflamed their pancreas is, what they're eating. So insulin is like that. You can't, it's very dose dependent. And these peptides are also very dose dependent. And everybody needs a different dose. And you can't just prescribe this dose and say, this is going to work for you. Because if you give too high of a dose, they're going to have side effects. And we don't want quick weight loss. That is not the end game.
Fair enough.
Yeah.
And no, this is brilliant. And so Jesse, I think you summarized it well, but like if you were to think, we'll talk about autoimmune conditions in a
Yeah.
second,
Yeah.
but
Yes.
if we were to take a, a perfect patient or client that would be eligible
Yeah.
for tirzepatide or
Yeah.
GLP-1s in your mind,
Yeah.
who would be somebody that you
Yeah.
would want to encourage
Yeah.
to bring in?
Yeah. You know what? It's the people that are already working out. They're already eating protein. They feel like they're doing everything to be as healthy as possible. And they've done it all and nothing seems to be shifting the needle. Those are the people that do amazing in our program. Although we actually have other people that, they have high cholesterol and they've tried things to lower their cholesterol levels and nothing's really shifted the needle on that either. Fiber hasn't changed things. And they're at the point where they don't really want to do a statin. They'd rather just see if they can lower their cholesterol other ways. The research is out there and we have seen it clinically. In 2 months, we saw total cholesterol drop by at least a point, LDL drop by a point, and that is like a huge drop in 9 or 10 weeks, like unbelievable. So we know that these peptides are somehow affecting, vascular inflammation, which is really well. And part of it is that these receptors are in the heart, they're in the liver, so they help with fatty liver disease. They're in the pancreas, they're in the brain. So in the brain, they help with reward centers. So for people that have a lot of food noise, and especially if they haven't eaten all day, they haven't eaten enough protein, and they get home and they just have the munchies, or they have a lot of alcohol addiction, it actually helps with the reward center of the brain. One of the really interesting things a lot of our patients have said that was, wow, I had a crazy shopping addiction, and once I started the peptides, they're not searching for dopamine, so their husbands, their partners are really happy because they've stopped shopping so much. And that's really amazing that, we can impact the reward center of the brain with these peptides because they stimulate these receptors in the brain that were not properly stimulated.
This is where I think it really gets interesting, Jesse. Like I totally forgot about. I came across that too, about like almost like a therapy for drug addiction and
Mhm.
potential upside and
Yeah.
when it comes to that. I'm so it sounds like we got receptors in the brain, and
Yeah.
you summarized that well. Is it it sounds like obviously we could affect uh the amount that we want to eat, uh inflammation in general. Is there anything other high level major pluses that you could think that the GLP-1s or
Yeah.
can also do?
So two big things, libido. So there's receptors in the testes, in the ovaries. So a lot of people have
Pass
noticed,
that
whoa,
along
yeah.
immediately. I'm totally joking. Totally joking.
Yeah, so that's one big huge one because as we age, that's a hard one to shift, right? So that's a big one, and then even joints and cartilage. So there are receptors in the joints, and obviously using other peptides at the same time could really help things. Stem cell regeneration is becoming big. Hopefully, at some point, it'll come to Canada. I just got back from Mexico. I had stem cell done, and I'm like, I feel amazing. Like that's pretty. I think having access to uh, these incredible ways of regenerating the body, and I think like one of the cool things is I think we're all aiming to have a really high quality of our later lives, right? So I think people sometimes hit 50, 55, especially some women, and they hit it, they're depressed, their brain's not working well. And I think what I've noticed is these peptides have been incredible for menopause, where, maybe bioidentical hormones have helped a little bit, but not quite with the neuroinflammation and this is where it really helps people with moods, stabilizing moods in menopause.
This
Yeah.
is really
Yeah.
exciting. So
Yeah.
you we also mentioned autoimmune conditions,
Yes.
and
Yes. Big.
I mean, you and I were texting about some pretty amazing uh, testimonials that you had there. But can you speak to us about indications why it may or may not work? Once
Yeah.
again, kind of the autoimmune conditions that you would think of that you'd want to try
Yeah.
and implement.
Yeah. Well, the biggest one is PCOS. I mean, polycystic ovarian syndrome, it's really synonymous with insulin resistance, right? And that's such a huge component of the ovaries being cystic and not having proper function. And I mean, people are told that you have PCOS, you probably can't have biological children. And if I really think PCOS an amazing spot where if we can get the insulin sensitivity and insulin resistance piece repaired, but also the autoimmune component involved with that back on track. I think, there's been tons of stories of people with PCOS getting pregnant after trying for years and years when they started the peptides. And so that's a really exciting one. I think for Hashimoto's thyroiditis, there are GLP receptors in the thyroid. And so we potentially think it's going to downregulate that. The most, there's two big, huge things we have seen with our patients. So one of our patients had lupus and sore joint pain for 3 years and a terrible rash and like really struggling with fatigue. And within 2.5 weeks after getting to the right Goldilocks dose, that joint pain has resolved and has not returned. So, is it going to come back? Potentially. Does that person want to peel off the microdose GLP-1 to find out? Not at this point. I mean, it's been incredible. But the other really cool thing is that that person also had kidney issues, and we're seeing improvement in kidney function. EGFR, creatinine levels are going back into the normal range, and we're tracking blood work every 3 months because we want to see the major improvements. So it's quite exciting. So that was a big one. And the other thing is I'm a huge type 1 diabetes advocate because my daughter has type 1. And she basically has started low dosing tirzepatide, and her insulin needs have steadily gone down since the beginning of December. So much so that while I was in San Diego and Mexico, I was checking her blood sugar like I always do, and it was in the normal range. And I got home on Friday night and I had found out that she stopped wearing her pump, which is crazy. And she had 5 days where like her blood sugar looked very, very, very normal. And so I had no idea. Her pump had died and then she didn't bother refilling it. And because she was taking the tirzepatide, her insulin needs have dropped a huge amount. And this is a kid where, last year she didn't use her pump or her pump fell off. She would spike up to 22, right? So we know that the tirzepatide is reducing her pancreas inflammation, and she's making her own insulin. We know that, which is very exciting. Her endocrinologist has been incredible, and she just said, way to go, just keep doing what you're doing. So, she's been very, very accepting of it. And before we started tirzepatide, I consulted with 2 pediatric endocrinologists that are using tirzepatide in the US. So it wasn't something I just jumped into with her. It was something that I felt comfortable. And because I track her numbers so carefully, it was very exciting to see that change.
Oh man, I
Mhm.
love this so much because it's just adding another therapeutic that clearly has less side effects than many others,
Yeah.
and allowing, well, specifically when I'm thinking your daughter, the ability to reduce that insulin load and reduce that inflammation, like
Yeah.
that's
Yeah, I
awesome.
know. It's amazing. It's amazing. And I think this is it. These peptides are natural. Like they're natural. They're peptides that our body actually makes, except that we're deficient. We're incredibly deficient. And we don't really know why we're so deficient. I think it's our lifestyle. I think it's like lack of exercise. But ultimately, this can be the little reboot that everybody needs. But the dose is so specific. And I really think that unfortunately, we're overdosing people on these peptides. And we only need enough to just get that receptor stimulated. So,
Wow.
yeah,
Wow. So so Jesse, let's plug the program a little bit. Like you got a new program, you're working with a nurse practitioner.
yeah,
What are we calling it?
yeah.
How do people sign up? What can they expect?
Yeah. So the program is called Pure Peptide Collective, and it's based here in Ottawa, but we're running it online. So anybody in Ontario can sign up. And with that program, basically, once you sign up, there is a 70-minute course that you get to take that covers everything you need to know about using these peptides the way we want you to be using them, which is making some big lifestyle changes if you haven't already. And from there, we give you a requisition for blood work so that we can get a really good baseline. We check pancreas function and amylase to make sure your pancreas can handle that weight loss, because pancreatitis is one risk factor for taking peptides. I personally think that it's probably the high doses of these peptides that are stimulating too much fat loss and stressing out the pancreas. So I think in low doses, it's much less of a risk. But we're actually looking for a big baseline so that in 3 or 6 months, when we retest people, we can say, hey, these are the incredible changes that are happening with the peptides. And I mean, one of my patients just wanted to be on it to lower their blood pressure because they just were sort of resistant to going on blood pressure medication. And within 3 days, we saw a huge change in diastolic and systolic blood pressure. So, again, decreasing inflammation in all levels of the body is the goal. And with proper biochemical testing and lab work, we can see the changes. And so you'll get some blood work, you take the course, and then you meet with us for an appropriate dosing call. So we get you on the right dose of the peptide, and then we have monthly calls. They're ask us anything questions. So it's a bit like this. People have lots of questions, but also we love to just share with our members all these big changes that people are having with their health.
So good, Jesse.
Yeah.
I'm can I just say too, just known Jesse now for I mean, I don't know, a while. And just I I it's- I haven't seen you with this much of a jump and this much excitement, looking this strong physically. Like I feel like mentally and physically you're in a really good place. And a lot has to do with what you're being able to offer your patients and clients because this is really exciting, in my opinion. This is something that is a natural compound that we all, it's in our bodies that, as you mentioned, for whatever reason, may be deficient in, and that's helping people's lives. Like, especially like when I hear about the insulin response, I hear about the autoimmune lupus response, and I hear about women that you're helping feeling better, stronger, and having an improved quality of life. This is big.
Yeah.
You know what I mean?
Yeah,
Not all of us could say that, right? So
yeah, for
I
sure.
I just want to really commend you for
Uh,
blowing this up. And honestly, is there anything we're missing, you think, in terms of that we'd want to cover in terms of
just that there's new research showing that it's leading to Alzheimer's and dementia prevention. And we know that, ultimately at the root of that is brain inflammation and insulin resistance. And like, I think it's the pathway to that's improving cognitive function. So it's exciting. I'd say, like, on our website, so we're purepeptidecollective.com. We have a research papers that are all lined up. Actually, one of our mutual friends, Erin Mulvihill, she's one of the authors on one of those studies. She's doing incredible research with Diabetes Canada on using these peptides. And I feel so lucky to have, recognize that this is a need in Canada. Like, people need to know that this is potentially gonna help them. And people that, unfortunately, the mainstream media is sometimes often frowning and shaming people for being on these peptides. And a lot of our patients want to do it to lose weight, and that's, I think it's fair. But the goal is, you have to, the end game is be strong, weight train, get enough protein,
Yeah.
sleep, and deal with your stress, which are all the things that you advocate on your podcast, Quadro. And so this program is fulfilling all of those things, but it's also giving people the edge up that they just need to get started, which is great.
And just to reinforce people, we were such believers that we even partner Guyata. We partner with these
Yeah.
guys. They, you sign up, you get discount offers for our supplements. And I gotta say, Jesse, once again, really proud of you. Really glad to see what you've been able to create. And I think the future is going to lead towards more and more involvement of the peptides. And I'm also, this is going to be a call out to
Yeah.
Erin too. We're going to have her on the show. Like, I want to pump up the research that she's doing. She's a game changer. So I would
Amazing.
love to get her on there too.
Yeah. Amazing. Thanks a lot, Quadro.
And yeah, so we mentioned the website. That's probably the main place where people could
Yeah.
track things down. We're not missing anything. Thank you so much, Jesse, for doing this. And we'll see you at a hockey rink soon, I
Yes,
am
for
sure.
sure. Amazing. Thanks a lot.